Hello, I'm Dr. Sofia Carter, a urologist and men's health specialist. Let me ask you something that most men don't think about until it becomes a real problem. Have you noticed that lately you wake up several times in the middle of the night just to urinate? Once, twice, sometimes even 3 or 4 times before morning. Or maybe you felt that your urine stream has become weaker, that you need to push harder, strain longer, yet it still feels like something is left inside. If any of this sounds familiar, please don't dismiss it as a normal part of getting older. The truth is that more than 70% of men over 50 make the same mistake every single day when they go to the bathroom. And what's worse is that most of them believe they're doing the right thing, while in reality, this small and harmless looking habit is quietly damaging their prostate little by little. I completely understand how frustrating this can be. Waking up again and again at night, losing precious sleep, starting the day already tired, with no energy for work, exercise, or even family life. I have seen hundreds of men in my clinic carrying that same exhaustion in their eyes, and I want you to know you are not alone, because the real cause of this problem is not your age. It's a wrong way of helping your body urinate, a pattern repeated for years without even realizing it. In the next few minutes, I'll explain exactly what that mistake is, how it silently harms your prostate, and most importantly, how a simple change in the way you urinate can help you sleep peacefully through the night again and wake up feeling strong, calm, and full of vitality. Not long ago, I met a patient named Mr. Manuel. He was 68 years old, a calm and disciplined man who had always taken good care of himself. But for the past few months, he had been waking up almost 5 times every night to urinate. Each morning, he came to my clinic with tired eyes and a quiet smile, telling me he felt completely drained, as if his nights no longer gave him rest. When I asked about his habits, he said something I have heard countless times before. He told me, "Doctor, I always try to push out every last drop because I'm afraid something might stay inside." That single sentence explained everything. It was the same mistake I've seen in so many men over the years. A mistake born not from carelessness, but from fear and misunderstanding. I gently explained to him that the body doesn't need force to urinate, it needs relaxation. The bladder and the prostate work best when the muscles around them are calm, not when they are being squeezed with pressure. I showed him a few simple changes and guided him through how to let his body release naturally instead of straining. 3 weeks later, he came back smiling. He said, "Doctor, last night I woke up only once, and I finally slept well." The joy on his face said more than any medicine ever could. I share this story because many men believe that their age is to blame for their nighttime urination. But in truth, it's often just a wrong habit, repeated for years. If you've ever experienced the same, I'd love to hear from you. Write in the comments, "I felt this too." Your story might help another man realize that he's not alone on this journey. Now let's understand what is really happening inside your body when you feel that you have to push in order to urinate. Many men believe this happens because their body is getting old or weak, but that is not entirely true. The real issue isn't weakness, it's pressure in the wrong place. Imagine your bladder as a soft water balloon. It slowly fills throughout the day, and when it's time to empty, the muscles around it contract gently so that the water can flow out through a narrow passage. At the base of that passage sits a small gland called the prostate. When you were younger, that area was wide and open, allowing urine to flow freely. But as you age, the prostate can become slightly enlarged, like a ring tightening around a straw. The passage becomes narrower, and that's when you start to feel resistance. Here's where many men make a mistake. Instead of relaxing and letting the bladder work naturally, they push harder from the stomach, thinking that will help the urine come out faster. But when you do that, the pressure moves backward. It pushes against the bladder wall and the prostate, not out through the passage. It's like squeezing a bottle when the cap is half closed. The liquid can't escape, and all you're doing is building pressure inside. Over time, this repeated pushing irritates and inflames the area around the bladder, neck, and prostate. The bladder has to work harder every day and eventually becomes tired. It forgets how to contract and release on its own. That's why many men feel that even after urinating, some urine still remains inside. Be honest with yourself. Have you ever felt that after urinating, you still need to go again just a few minutes later? If yes, type yes in the comments below. It's nothing to be ashamed of. It's simply a sign that your body is asking for help. Always remember, urination is not an act of force. It's an act of relaxation. When your body learns to stay calm, the flow returns naturally. In the next part, I'll show you how this habit of pushing creates a dangerous cycle of swelling and infection, and why breaking that cycle can completely transform your nights, your energy, and your confidence. Every time you strain to urinate, it may feel as if you're finally emptying your bladder completely. For a short moment, it brings relief, but inside, something very different is happening. A small portion of urine still remains trapped because the bladder can't push it all out. Day after day, as this happens again and again, that leftover urine slowly stretches the bladder. The muscles begin to lose their natural tone and start working harder than they should. It's like asking your heart to beat faster all the time. Eventually, it gets tired. When the bladder becomes tired, it forgets how to contract properly. That's when your urine flow becomes weaker, slower, and incomplete. Doctors call this condition a lazy bladder. It means that the bladder no longer responds the way it once did. You may feel the urge to urinate often, but only a small amount comes out each time. The rest stays inside, and that stagnant urine becomes the perfect environment for bacteria. Over time, infection develops, the prostate swells even more, and the passage becomes even tighter. This is how the vicious cycle begins. You strain to push. The pressure causes inflammation. The inflammation narrows the passage. You feel the need to push harder next time. Night after night, your sleep breaks again and again. You wake up tired, your heart rate fluctuates, your blood pressure rises, and your mind loses its calm. Even intimacy and confidence begin to fade. But here's the most important part. This cycle can be stopped. You don't need complicated treatments to begin healing. The moment you learn to let go, to stop forcing and start relaxing, your body begins to recover. So please, listen carefully to what I'm about to explain next. I'll show you the single most common mistake that almost every man makes in the bathroom, the one small action that silently harms the prostate more than anything else. And once you understand it, you'll know exactly how to protect your body for the rest of your life. And now let's talk about the mistake I mentioned at the very beginning of this video. It's the same mistake I've seen in more than 9 out of 10 of my patients, and most of them have no idea that it's quietly damaging their prostate every single day. That mistake is straining while urinating. Every time you hold your breath, tighten your stomach, and push hard to make the urine come out faster, you're actually sending pressure backward toward your prostate and the neck of your bladder. The more you push, the more pressure builds up, and instead of helping, it begins to create tiny internal stress and irritation. Think of it like trying to force water through a pipe that's already narrow. The harder you press, the weaker the pipe becomes over time. The walls stretch, small cracks appear, and the pressure keeps rising until the whole system becomes tired and inflamed. This is exactly what happens inside your body when you strain during urination. I understand that most men don't do this intentionally. No one ever teaches us how to urinate correctly. From childhood, we're told how to eat, how to sleep, how to exercise, but never how to let the body release naturally. So please remember, this isn't your fault. It's simply a habit that was never corrected. The good news is that because it's a small habit, it can be changed easily. You can start healing simply by learning to relax again. Before I show you exactly how to do that, I want to ask you one simple question. When was the last time you urinated? Did you strain even a little? If yes, type in the comments, I used to do that. You'll be surprised to see how many men share the same experience, and you'll realize that you are not alone in this journey. Now that you understand where the problem truly lies, let's talk about how to fix it. The goal is simple, to help your body urinate in a natural, effortless, and healthy way, without straining, without tension, and without leaving urine behind. The technique I'm about to teach you is called the relaxed voiding technique. It's one of the most effective and gentle ways to restore balance in your bladder and prostate. I've taught it to hundreds of men in their 50s, 60s, and even 70s, and many of them noticed real improvement in just a few weeks. The steps are simple, but what truly matters is patience and awareness. Step 1. When you feel the urge to urinate, do not hold it. Many men make the mistake of waiting, finishing a task first, or ignoring the urge until it feels stronger. But when you delay, your bladder stretches more than it should, and the muscles have to work harder to release the urine later. Over time, this weakens your bladder and forces you to strain. So when your body gives you the signal, listen. Go right away. That is the first step toward healing. Step 2. When you enter the bathroom, don't rush. Take a few seconds to stand or sit quietly and take a deep breath. Place your hand gently on your lower abdomen and feel how your breath moves downward. As you exhale slowly through your mouth, imagine all the tension leaving your body. Each deep breath tells your nervous system that it's safe to relax. Step 3. As you begin to urinate, do not push. Don't hold your breath or tighten your stomach. Simply allow the urine to flow naturally, like water running downhill. At first, the stream may feel weak or slow. That's perfectly fine. It only means your body is relearning how to release without effort. Gradually, the flow will become smoother and more continuous. Step 4. If the stream stops midway, stay calm. Take another deep breath, relax, and wait a few seconds. You'll notice the flow starts again on its own. That short pause is actually a positive sign. It shows your bladder is regaining its natural rhythm. Step 5. When the flow stops completely, don't stand up right away. Wait a few moments, lean slightly forward, and exhale softly. Many men are surprised to see a small second stream appear. This is called double voiding, and it helps your bladder empty more completely. Step 6. If possible, try urinating while sitting down, especially in the beginning. I know it may feel unusual because men are used to standing, but sitting allows your pelvic muscles to relax fully. It reduces pressure on your prostate and makes the process smoother and safer. This has nothing to do with masculinity. It's simply a smart and caring choice, a sign that you understand your body and know how to protect it. Some men ask me, "Doctor, how long will it take before I notice a difference?" And I always answer, not overnight, but sooner than you think. If you practice this technique every day, within 10 to 14 days, you'll start to notice clear changes. Your stream will feel stronger and steadier. Your bladder will feel lighter after each urination. And most importantly, you may finally sleep through the night without waking up again and again. Always remember, urination is not an act of power, it's an act of release. When your mind learns to relax, your body begins to heal itself. Each time you follow these steps, you're giving your bladder time to rest, your prostate time to calm down, and your natural rhythm the chance to return. And now, if you'd like to make this healing process even faster, stay with me. In the next part, I'll share 3 small but powerful daily habits that can multiply your results and bring lasting relief. If you truly want the relaxed voiding technique to work at its best, there are 3 small habits that will help you heal faster and make the results last longer. These are simple changes, but when you practice them consistently, they can make a huge difference. The first habit is to urinate while sitting whenever possible. I know this may sound strange for many men because they've spent their entire lives urinating while standing. But sitting helps your body in ways you might not expect. When you sit, the pelvic muscles, the ones surrounding your prostate, can fully relax. The pressure inside your abdomen drops, allowing urine to flow freely and completely. For many of my patients, this one change alone reduced their nighttime urination by almost half within just 2 weeks. Try it for a few days and see how your body responds. The second habit is to slow down. Many men walk into the washroom as if they're racing against time. They rush, they push, they try to finish quickly so they can get back to whatever they were doing. But urination is not a task to complete. It's a short moment of rest that your body deserves. I often tell my patients to treat every visit to the toilet as 1 minute of meditation. Take a deep breath, feel your body, let the water flow naturally, and listen to the gentle sound of the stream. That sound means your body is functioning exactly as nature designed it. When you slow down, you not only help your bladder relax, but also train your nervous system to stay calm throughout the day. The third habit is something I call double voiding. When your stream stops, don't stand up immediately. Stay still for a few seconds, lean forward slightly, and exhale slowly. You'll notice a small second stream coming out. That small amount is the urine that usually stays behind. Practicing double voiding each time helps keep your bladder completely empty and reduces the need to wake up at night. Many of my patients have told me that after adding this simple step, their sleep became deeper and more peaceful. Always remember, no medicine is more powerful than understanding your own body. These small changes may look simple, but they carry great power. When you treat your body with patience and kindness, it rewards you with balance, strength, and calm. If you've already started practicing these steps, or if you're planning to, I'd love to hear about your experience. Tell me in the comments how many days you've tried, what you noticed, and what felt different. Sometimes, your story can become the hope another man needs, someone who's silently struggling with the same problem. In the next part, I'll answer some of the most common questions men ask me about this technique, questions that might also be on your mind right now. Stay with me, because a little more understanding will make your healing even easier. I know that after hearing about the relaxed voiding technique, many of you might still have questions. These are the same questions that my patients often ask during their first few visits, and I want to answer them clearly so that you can continue this journey with confidence and peace of mind. The first question almost every man asks is, Doctor, if I don't push, will my bladder really empty completely? What if something stays inside? I completely understand this concern. Most men feel more secure when they force the urine out, believing that this guarantees a clean bladder. But the truth is the exact opposite. When you push, the muscles around your prostate and pelvic floor tighten and close the passage even more. The urine becomes trapped, which makes you feel heavy and uncomfortable afterward. When you relax, your bladder contracts naturally and empties far more efficiently. So please remember, your body already knows how to do this on its own. You just need to trust it again. If you still feel that a small amount remains after you finish, use the double voiding technique. After the first stream stops, wait a few seconds, breathe slowly, and lean forward slightly. You'll notice a gentle second stream of urine. That's the leftover portion your body was holding. This step helps ensure your bladder is truly empty and you'll sleep much better through the night. Another question I often hear is, Doctor, are there any devices or medicines that can help me? The answer is yes, but they're usually needed only in severe cases, when the prostate has grown too large or when the bladder has lost much of its natural reflex. In those cases, doctors may suggest medical options such as a small stent or a procedure called urolift, which uses tiny implants to lift and open the blocked passage. But for most men, this isn't necessary. I always encourage my patients to first try the natural retraining method for at least 30 days. You'll be amazed by how much your body can recover once you simply correct the way you urinate. Another common concern is, Doctor, I'm already older. Is it too late for me to change? My answer is always the same. It's never too late. The prostate and bladder are made of living, adaptable tissue. When you give them rest and proper function, they begin to heal automatically. Just as muscles regain their strength when trained correctly, your urinary system can also regain its natural rhythm when treated with patience and care. So please don't lose hope. Age is not the enemy here. Ignorance and stress are. The moment you start treating your body with understanding instead of force, it begins to respond with balance and strength. If this information has helped you understand your body better, tell me in the comments below what question you had before watching this video and whether it was answered today. I always read your comments, and sometimes your question helps me create the next video that could change another man's life. In the next part, I'll guide you through a few lifestyle habits that support this healing process, habits that not only improve your prostate health, but also restore your overall vitality and peace of mind. By now, you've learned that taking care of your prostate is not only about how you urinate, but also about how you live every day. Your body heals best when every part of your lifestyle supports balance and calm. The first habit to build is proper hydration. Drink enough water throughout the day so your body stays clean and your circulation remains active. But avoid drinking too much in the late evening. Let your last glass of water be at least 2 hours before bedtime. This gives your bladder time to rest and allows you to sleep peacefully through the night. The second habit is to be gentle with your diet. Reduce coffee, alcohol, and very spicy foods because they can irritate your prostate and make you urinate more often. Instead, include more green vegetables, ripe tomatoes, pumpkin seeds, and fish rich in omega-3s. These foods help calm inflammation and support healthy blood flow around your pelvic area. The third habit is simple movement. Even 15 to 20 minutes of walking or stretching each day keeps your blood flowing to your bladder and prostate. Movement is medicine, and consistency is the real cure. And finally, take care of your inner world. Stress, anger, and worry tighten the same muscles that help you urinate. When your mind relaxes, your body follows. Practice calm breathing, spend time in nature, and remind yourself that healing is a gentle process that takes time and care. Age does not take away a man's strength. It simply asks him to care for his body with more awareness. When you treat yourself with patience, kindness, and respect, your body responds with energy, balance, and confidence that lasts a lifetime. Thank you for watching and staying with me until the end. If this video has helped you understand your body better, please share it with someone who might also need this knowledge. You never know whose life you could touch with a simple act of care. If you've already started practicing the relaxed voiding technique, tell me in the comments how it feels after a few days. Your story might be exactly what another man needs to find the courage to begin his own healing. Remember, this video is meant for education and awareness. It does not replace personal medical advice. If you experience severe pain, blood in your urine, fever, or difficulty passing urine, please consult your doctor or urologist right away. I'm Dr. Sofia Carter, and I believe that true strength doesn't come from force, it comes from understanding and compassion. Take care of your body, treat it gently, and it will serve you with balance and vitality for many years to come.